Welcome to a patient's guide to the Silver Cross Sleep Disorder Center. If you suspect you have a sleep disorder, such as sleep apnea, contact your physician so he or she can refer you to our state-of-the-art Sleep Disorder Center. The Silver Cross Sleep Disorder Center treats and diagnoses the following sleep disorders: obstructive sleep apnea, sleep-related breathing disorders, insomnia, sleep-related movement disorders, and narcolepsy. Once your order is sent by your primary care physician and received in the sleep center, a representative will contact you. A package of information, including a 6-page sleep history questionnaire, will be mailed to you to bring to the consultation with the sleep specialist. The sleep specialist will review your medical history with you and may request that you undergo a formal overnight sleep study. Since sleep medicine is a specialty area, your insurance may only require that you complete a sleep history questionnaire. The Silver Cross Sleep Disorder Center is conveniently located on the Silver Cross Hospital campus at I-355 and Route 6 in New Lenox. Generally, you will be arriving at the hospital around 8 to 9 p.m. in the evening. Once you enter the main entrance, you approach the main desk in the lobby, and a service ambassador will help you find your way. Upon arrival, you will be greeted in the waiting area by a trained professional sleep technologist who will be performing your sleep study. The technologist will escort you to a private room where you will change into your sleep attire. The technologist will then provide you with a brief overview of everything that will be happening during your study and answer any questions you may have about your study. Your sleep study is a painless and non-invasive procedure. The technologist will begin your setup. Leads will be placed on your scalp using a water-soluble paste to monitor your brainwave activity. We will monitor your leg movements, eye movement, snoring, oxygen levels, cardiac rhythms, respiratory effort, and nasal oral airflow. You will not be injected with anything. Sensors are applied using stickers or tape. You will not experience any discomfort during this process. Almost everyone can fall asleep, although it may take a little longer than average. Whether you are a back sleeper or a belly sleeper, you will be allowed to sleep in any comfortable position. Once you are set up, you will have the time to sit, relax, and read or watch TV before we initiate the actual study. This will allow time to get accustomed to the feeling of the leads and wires. While you are sleeping, the technologist will be located down the hall and continuously monitor your activity throughout the night. He or she pays close attention to your sleep waves, breathing, heart rhythm, oxygen levels, and documents any changes which may occur during your testing. The technologist is nearby if you need assistance at any time throughout the night, such as using your bathroom. He or she may enter your room after 2 hours of recording to apply the CPAP therapy should you demonstrate frequent sleep-disordered breathing early in the testing process. This is called a split-night study. During a split-night study, the technologist will intervene by waking you, assisting you in a sitting position, and applying a CPAP mask to help you treat your sleep apnea. Many patients, however, do not undergo a split-night sleep study because they may not exhibit sleep-disordered breathing until later in the test. In this case, a second overnight study called a CPAP titration study will be recommended by the sleep specialist. During the CPAP titration study, the CPAP therapy is initiating prior to beginning the test. There are 3 main styles of masks: the nasal mask, the nasal pillows, and the full face mask. If you find discomfort with the mask type, your technologist may assist you to achieve optimal comfort. The technologist will initiate the therapy at a low setting and gradually increase the amount of air coming out of the CPAP machine. This is called titration. The titration can only occur when you are asleep and for reasons such as apnea, partial airway obstructions, snoring, and low oxygen levels. Documentation of all physiologic changes during your sleep study are entered into the computer for the sleep specialist to view. Data from the sleep study is invaluable in diagnosing and treating any sleep disorder someone may have. When morning arrives, your technologist will wake you, remove all connections from your body, and transfer your data for analysis. The raw data is analyzed within 48 hours and ready for interpretation by the sleep specialist. Once the sleep specialist interprets your sleep study and generates a formal report, you will receive a phone call. Your results, as well as the recommendations for treatment, are shared with you. The entire process takes approximately 7 to 10 business days following your overnight stay. If CPAP therapy is recommended, either the sleep specialist or your primary care physician will order the medical equipment and follow up with your care. During your follow-up visit with the sleep specialist, the physician will discuss the effectiveness of your CPAP therapy, prescribe medications, discuss lifestyle changes, approve or recommend outpatient surgery, or refer you for oral appliance therapy. Through these treatments, many sleep-disordered patients now can enjoy a good night's sleep. For more information, contact the Silver Cross Sleep Disorder Center at 815-300-REST or visit our website at www.silvercross.org.